talk about functional medicine, natural living, and more. Today's video is part 2 of our gut health series, where I'll be breaking down for you guys some of the most common GI related diseases and diagnoses and helping to educate you on options for treatment and testing that might be new to some of you if you have solely been following in the conventional healthcare system. I'm going to start off today talking about IBS because this is so common. So, IBS is irritable bowel syndrome, and this affects approximately 10% of American adults. Sadly, about 75% of those affected never really seek any treatment. They just suffer with their symptoms. The symptoms tend to include things like bloating, gas, abdominal pain, diarrhea, constipation, or sometimes people will have a pendulum where they swing back and forth between the two extremes. It is not limited to GI symptoms, however, and IBS has often been linked to things like migraines, restless leg syndrome, chronic fatigue, back pain, and many things. These symptoms can cause a tremendous amount of stress in the people that are affected, and so it's no wonder that it really impacts their quality of life. Unfortunately, with IBS, it's kind of a diagnosis of exclusion, meaning that you will probably get $1 million workup to find out that you have IBS, which essentially is just a catch-all. Basically, that means we don't know. What we do know is that this is not going to kill you, but we don't really know what is the cause. Traditionally, you will have gone through a series of tests, probably including CT scans, ultrasounds, even colonoscopies and endoscopies, to try to take a better look and see what's going on. Unfortunately, all of these can come back normal despite having persistent symptoms. And as someone who has been there, it is so frustrating to be told that you're normal when you feel like trash and you're having all these symptoms all the time. How can you possibly be normal? So there are definitely some other functional medicine tests that you can consider. So the first thing that I would suggest for someone who's dealing with irritable bowel syndrome would be to see a functional medicine provider and get some of the following tests. SIBO, which stands for small intestinal bacterial overgrowth, has been hugely linked to IBS. And I'll talk more about different ways that can be tested, but it's a very, very simple test to determine whether or not that could be part of your problem. Food sensitivity testing is super important. Just because a food is healthy doesn't mean it's healthy for you. Because if you are suffering with leaky gut, like I discussed in my last video, and if you haven't seen that, go back and watch so you can understand the baseline for how the GI system is meant to function. If you are dealing with leaky gut, you can develop food sensitivities to essentially anything. This might be why all of a sudden you've noticed you have excruciating pain when you eat something that this seems so harmless, like green peppers or bananas or avocado, things that you would typically think is being healthy. Your body can create an inflammatory response to anything when you have leaky gut. So getting food sensitivity testing can be super helpful and can be done very simply through a blood test at your functional medicine doctor's office. Another thing to consider would be getting stool testing for chronic infection. Now, I know this doesn't sound fun. It's really not as bad as it sounds. But chronic infection can really trigger a lot of GI symptoms. Sometimes when the microbiome is altered or not functioning appropriately, you can get opportunistic bacteria, and I talked about this in my last video, that grow out of control. You can also have low-lying chronic infections that your body cleared enough to get rid of the main symptoms but never fully eradicated. So getting some testing for chronic infection is definitely important when you're ruling out things like this. The last thing that I would for sure recommend would be getting tested for celiac disease. Now, this is interesting because a lot of people don't necessarily link their symptoms to gluten, but celiac disease is so important to know. If that is your diagnosis, you need to know that you have it. So you need to 100% avoid gluten, as we'll talk about in a few minutes. So those are some of the few things that I would recommend as a baseline start for functional medicine testing if you're having symptoms that have not been able to be resolved with your current treatment plan. Interestingly enough, in some people, about 25% of people who have IBS, it is caused by a chronic infection, even something as simple as food poisoning. And what happens is the food poisoning affects the cells in the mucosal layer of the lining of the intestines, which creates inflammation, which causes smooth muscle changes. Once the infection is acutely over, however, sometimes these smooth muscle changes persist and can alter your bowel habits by either making them too speedy or too slow. Other treatments that you might consider under the guidance of your provider would be doing an elimination diet, which sometimes is done after food sensitivity testing. Doesn't always have to be, you don't always have to have the testing done first, but sometimes you might wish to know exactly what you need to avoid. There are some general ways that you can go about it under the guidance of your doctor who can help you to remove trigger foods and inflammatory foods and help you to heal the gut in order to be able to reintroduce those foods back into your diet. Another interesting thing about IBS is that about 2/3 of people who are affected with IBS are also lactose intolerant. So one easy thing that you can even try on your own is removing all dairy from your diet for at least 2 weeks. I would probably recommend 3 weeks because dairy remains in your system for a long time. So it takes a while for you to be able to tell if you're really feeling better. So I would recommend, if you have been given a diagnosis of IBS, that you try a trial of being dairy-free. This is not as hard as it used to be. There are so many wonderful alternatives and things you can try. I will just say be careful to read every label because there is a lot of hidden dairy in things that you might not even suspect. Probiotics have also been shown to be helpful in many studies, and I will be doing a video in the future about how to choose a probiotic effectively because that can be such a Pandora's box trying to go and choose one. But specifically for IBS, you definitely want to have one that includes both lactobacillus and bifidobacteria. I always believe in a food first approach, meaning that before you spend tons of money on expensive supplements and herbs and things like that, it's best to give it a shot first, adjusting and altering your dietary intake to see if that helps relieve your symptoms. If you are unsuccessful with relieving your symptoms with a food-only approach, definitely connect with your functional medicine provider to get some of the testing that I described and get some personal specific recommendations for you. The next category of diseases I'm going to be discussing are inflammatory bowel diseases, so IBD. The most common ones that you likely hear of are Crohn's and ulcerative colitis. There are 4 total inflammatory bowel diseases. The other one is microscopic colitis and ischemic colitis. They're pretty rare, and microscopic colitis tends to be genetic, and ischemic colitis tends to be more related actually to the cardiovascular system in people who are over the age of 60. So for this video's purposes, I'm not going to be discussing those in depth, but I will be discussing Crohn's and ulcerative colitis here. So IBD is very similar to IBS, except for with inflammatory bowel diseases, the gut becomes inflamed, the intestines develop inflammation as opposed to those smooth muscle changes that you see with IBS. With IBD, you tend to get inflammation, and this can be severely problematic. It is considered to be an autoimmune disease, and people who have inflammatory bowel diseases can suffer from poor absorption of nutrients, severe abdominal pain. They can have blood in their stools. And if you are experiencing any of those symptoms, please get that evaluated immediately by your doctor, because there can be many other very serious conditions like colon cancer and things like that that would require urgent medical intervention. So if you are experiencing those kinds of symptoms and you have not been evaluated, please get that checked out as soon as possible. So the first one I'm going to talk about is ulcerative colitis, which can be affectionately known as UC. UC essentially is a chronic inflammation of the mucosal lining of the colon. And what happens in these cases is that the GI tract can develop sores that can bleed and commonly do require surgery. Chronic inflammation can also lead to perforation of the colon, which is super serious and important to get checked out. And this chronic inflammation and perforation and things can increase risk of colon cancer. So it's very important that you are maintaining your relationships with your primary care doctors and your gastroenterologists to get your regular screenings. Treatments are typically focused on managing inflammation, trying to decrease that in the body, but there may be a lot more issues at play. Some researchers have suggested that there's a large link between leaky gut and ulcerative colitis, as well as an inability to fight infection, which can also be related to the leaky gut and poor microbiome health. If that is the case, then repairing the gut lining through elimination diets, gut healing protocols, and improving gut immunity with targeted therapies could have really significant positive outcomes for those who are struggling with UC. If you have ulcerative colitis, one person that I highly recommend you go check out is Danielle Walker, and I will link her information in the box below. She has a really fascinating story about how she has managed her UC for many, many years with dietary interventions, along with some conventional medicines along the way as she's needed them. She has a great book. I believe it's called Food Saved Me, which I listened to on audio, and I love when the author does a narration herself. So highly recommend. I'll link those below. But she has a great testimony of how she was able to manage her symptoms through her diet for a long time. And she also discusses a lot about when to know, or when she knew that she needed to get other medical interventions. So again, none of these suggestions are meant to be excluding conventional treatments. A lot of times they can work in a really nice partnership to support each other, but it's very, very important that you don't ignore your symptoms. If they are getting severe, please make sure you're always reaching out to your providers. The next thing we're going to be discussing is Crohn's. So again, that's another inflammatory bowel disease, and Crohn's often shows up with abdominal pain, diarrhea, and weight loss. Crohn's can occur anywhere in the GI tract, but often shows up on the right side of the colon, as opposed to ulcerative colitis, which typically presents on the left side. So while Crohn's is inflammatory like ulcerative colitis, the pattern and the distribution of the inflammation is where it differs. It can also penetrate much deeper into the mucosal lining, which can cause things like abscesses It can cause fistulas to develop, which fistulas in a simple term is essentially a little hole or opening from one part of the body to another that aren't supposed to be there. So the inflammation can create a fistula over time, and this is a serious situation. Sometimes Crohn's does require surgery, and by all means, please seek conventional treatment if you are at that point. Functional medicine can help you post-op to recover, as you will need to know what part of the colon was removed, because it's important to know where you are now needing support. You need to support your body as different parts of the GI tract and the intestines do different things. So I would highly recommend, if you've had surgery on your colon due to Crohn's, that you seek out a functional medicine provider who can help you to optimize the remaining part of your colon post-op. Interestingly enough, there is some research out there that shows that Crohn's and other inflammatory bowel diseases may have an allergic component, which is really interesting. And there's some studying going on about its relationship to histamine. So it may be something to discuss with your doctor if you've never discussed histamine or the allergic component to Crohn's. The next thing I want to discuss is GERD. Now, we're going a little backwards in the GI tract. We're going upward, talking about GERD, which stands for gastroesophageal reflux disease, aka heartburn. This is super common and usually presents itself with symptoms like burning, pain, tightness around the chest, feeling overly full, feeling nauseous, having excessive gas, burping, and in some cases even coughing and wheezing, which is very interesting. It can even progress to the level of trouble swallowing. This is typically seen with people who have had chronic reflux disease, as the lining of the esophagus becomes damaged and the inflammatory response creates like a hypertrophy, like an overgrowth of the tissue, and can make it difficult to swallow. Traditionally, the thought behind the treatments for reflux diseases like GERD is that there was too much acid, but a lot of recent research is actually showing it's not too much acid, it's acid in the wrong place. Gastric acid is so strong, it's literally able to burn you. Like if it were to get on your hand, it would burn you. It's one level down from battery acid. So you can see why you want it to stay in its place. Your stomach has a protective lining that is able to handle it without getting damaged, but the esophagus does not have the same lining, and that is why when the acid refluxes upwards into the esophagus, you feel that pain. When you think mechanically about the anatomy, there's a sphincter at the end of the esophagus that is supposed to open to let food pass into your stomach and close to keep it in the stomach and prevent it from refluxing back. Sometimes medications can affect the esophageal sphincter. Definitely nicotine can affect it, as well as NSAIDs like ibuprofen, aspirin, Aleve, birth control pills, steroids, and more. Other triggers for reflux include stress, shocker, wearing tight clothing around your midsection, eating meals late at night and then lying down. Talked about smoking, definitely can impact the esophageal sphincter and trigger that acid reflux. Interestingly enough, the signs and symptoms of low stomach acid are essentially identical to the signs and symptoms of excessive stomach acid, so it's very important that you seek appropriate treatment. Traditionally, the treatment for acid reflux disease and for GERD is PPIs, proton pump inhibitors, and there's a lot of discussion about that in the healthcare world right now because Proton pump inhibitors are going to lower the acidity in the stomach, which temporarily in the short term does make you feel better, but can contribute to a whole host of other issues because there's a reason why your stomach acid is that strong in the first place. If you have poor stomach acid, it's very likely that you're going to have difficulty digesting your food appropriately, and then that leads to leaky gut, and that leads to other issues as we have discussed at length. So it's actually quite important that you maintain the appropriate level of acidity. If you have been taking PPIs, do not stop them cold turkey. That is not a good idea, but you can work with your doctor to try to wean down from them gradually, and you can address some of those lifestyle factors. Some other testing that you might want to consider that you may not have had would be getting tested for H. pylori, which we'll talk about next. Celiac, again, food sensitivity testing, again, definitely can be good places to start. Another functional, very simple thing would be elevating the head of the bed while you are sleeping. If you have to eat late, if you don't get home from work until late, or whatever the case may be, you can try to elevate the head of the bed. You may want to consider taking melatonin. Check with your doctor first, but melatonin is really interesting because it can help to tighten the esophageal sphincter, which helps to keep food and acid where it belongs. Another really big consideration when dealing with any of these GI diseases, but specifically with GERD, is food hygiene. Now, this may sound ridiculous to you. It may sound so basic, but you would be surprised at how many people need help in this area. Food hygiene essentially is the discussion of the literal way that you are eating your food. If your body is in a state of stress, then your body is literally not able to produce the necessary stomach acid to digest your food. When you're in a fight or flight state, the sympathetic nervous system is activated and is going to shuttle energy away from the GI tract. So when you eat, you're going to have a very difficult time at breaking down your food. It is also really unfortunate but common to think about how little people actually chew their food. I read a stat once that you should try to chew each bite 20 times. Essentially, you should chew your food to the consistency of baby food before you swallow it in order to improve digestion and to allow acid to break the food down appropriately. So many people are eating on the run, eating on the go in a high stress environment. They're not sitting down, they're not practicing mindfulness, taking a breath, saying a prayer, pausing and breathing. So food hygiene can really impact the way that you digest your food. And this can be a very significant factor in reflux disease management. If you find yourself eating a lot of times in a stressed state, a simple practice can be sitting down and taking 5 slow, deep breaths in your nose and out of your mouth in order to bring yourself back into the parasympathetic state, which includes the rest and digest parts of your body. Interestingly enough, also, when you practice food hygiene like this, it stimulates the salivary glands to begin to produce more enzymes that it needs to break down the food. So it's amazing how it all works together. If things like GERD are left untreated, they can progress to ulcers, which can be very dangerous, very painful, and problematic. One of the most common causes of ulcers is H. pylori, and we talked about this, or I mentioned this briefly earlier. H. pylori is a bacterial infection and stands for Helicobacter pylori, and it's an infection in the stomach. H. pylori is really tricky and sneaky in the sense that it can trigger an immune response and can cause or can exaggerate leaky gut, wreaking havoc all through your GI tract. And it can actually affect many body systems. It's really pretty fascinating actually when you study H. pylori because you see that about 50% of the population has H. pylori present. So that begs the question, why is it only problematic in a certain population and why do some people have no trouble with it at all? Probably lifestyle factors play a big role and immune factors that can help to keep infections at a low level before they begin to proliferate and cause trouble. But this is all still being studied. So typical treatment for H. pylori infections includes triple or quadruple antibiotic therapy and retesting about a month later to see whether or not the infection is still present. It is super rare that it will recur, but it is possible. And while this may be necessary to do, you need to consider the impact of such treatment and therapy on your gut because antibiotics will definitely cause damage to the gut bacteria. And you need to have a specific plan in place to rebalance the microbiome after that because it can take anywhere between 6 months and 2 years to restore the balance as best as you can. And in some cases, after antibiotics, the balance will never quite be the same. There are some bacteria that will be permanently lost. Now, I'm not discouraging you from taking antibiotics if they're necessary. Please do that. But it is important to know the impact that they have on your body so you can manage it and support it afterwards. And there have been some non-antibiotic treatments that have been tested and are showing some success in treating H. pylori that please discuss with your doctor again before you decide to implement any of these on your own. Compounds in cruciferous vegetables like broccoli and cauliflower have shown some success. Fermented foods, probiotics, cranberry juice, aloe vera. Actually, aloe vera is even approved by the FDA as a treatment for H. pylori, which is a big win. Staying very well hydrated is actually really helpful for H. pylori, and it sounds so basic, but a lot of people who suffer from reflux disease, ulcers, and that can be caused by H. pylori have noticed significant decrease in their symptoms when they stay extremely well hydrated. Of course, always consult your doctor, but a specific type of licorice called DGL licorice has also been studied and has been shown to be helpful because it makes your stomach an inhospitable place for the bacteria to grow, so it can't proliferate anymore. So consult your doctor there for specific types and for dosages. Again, you have to consider that H. pylori is only one cause of ulcers, so it does cause a large portion of them. There's many other lifestyle factors like stress, overuse of NSAIDs, which are non-steroidal anti-inflammatory medications like ibuprofen, Aleve, aspirin. This can definitely change the lining of your stomach and contribute to ulcers. So definitely get that checked out if you have been overusing medications like that. But H. pylori testing is definitely something that you should consider if you are having reflux or ulcer type symptoms. So ask your doctor about it. You can get it tested 3 ways: through breath testing, which is really interesting. You can get it through blood testing, and you can get it through stool testing as well. So the last big diagnosis that I want to discuss today is celiac disease. And celiac disease is a genetic and autoimmune allergy to wheat-containing gluten grains. People who have celiac have inflammation that causes damage to the small intestine, and the small intestine is really important for absorbing nutrients and material from your diet. So People who suffer from celiac disease oftentimes also suffer from malnutrition. Despite eating healthy, they may not be able to actually absorb the nutrients in their food due to the damage in their intestine. Now, we could talk a lot about gluten, and I have a whole podcast about it coming up, so stay tuned because there's a lot to say about whether or not our problem really is with gluten or with what we have done to our food that creates the issue. But people who have celiac disease absolutely 100% must avoid gluten at all times. Some of the most common symptoms that you think of when you think of celiac would be digestive problems, abdominal pain, diarrhea, difficulty gaining weight or losing weight without trying. Those are all symptoms of celiac disease. But fascinatingly enough, only 1 out of every 8 to 15 people who are diagnosed with celiac present with GI symptoms. In fact, I'm going to read you a list, and bear with me because it is significant, that you will be able to hear the other ways that celiac disease presents, which is why I've suggested it as testing all along the way for other GI problems, but definitely consider it if you're experiencing any of the following. So the list includes abdominal cramps, Addison's disease, anemia, asthma, autism, bruising, carpal tunnel syndrome, dairy intolerance, dementia, depression, dizziness, ear infections, epilepsy, fatigue, fibromyalgia, fluid retention, GERD, GI bleeding, hives, infertility, inflammatory bowel disease, interstitial cystitis, juvenile arthritis, kidney disease, magnesium deficiency, migraines, miscarriages, multiple sclerosis, nosebleeds, obesity, osteoporosis, osteopenia, panic attacks, psoriasis, rheumatoid arthritis, schizophrenia, Sjogren's disease, small intestinal bacterial overgrowth, thyroid disease, Turner syndrome, vitamin deficiencies, weight loss, Williams syndrome. That is just a partial list of things that can be affected by celiac disease that have really not a lot to do with the gut as far as your actual symptoms. It has everything to do with the gut as far as the state of the gut, but the symptoms do not always present that way. Unfortunately, from the time that a person has onset of symptoms for celiac, it takes on average 6 to 10 years for them to get a diagnosis, which is really a shame because during that prolonged amount of time, they are suffering and the inflammation is continuing. This contributes again to leaky gut, so go back to my other video and learn more about what leaky gut is and how it affects your body. But this damage continues to occur over time. So once you have completely removed all gluten from your diet, which can be tricky to do because, again, like I was saying with eliminating the dairy, gluten is hidden in many things that you would not necessarily think of. So always read labels. If you have been diagnosed as a celiac, make sure you are really reading the labels and you understand what you're reading. But I would highly suggest identifying other food sensitivities and doing a gut healing protocol after you do an elimination diet. About 50% of people who have celiac disease are also lactose intolerant, so it may be beneficial for you to remove dairy products as well. The enzyme lactase that breaks down the dairy products is actually synthesized in the small intestine, and so with that being the primary source of inflammation and damage in the gut when you have celiac disease, your body is actually not able to create and produce the amounts that you need of the lactase to break down the dairy products. But it is possible that if you do the gut healing protocol and you actually heal the gut, that you might be able to reintroduce dairy back in. Unfortunately, there is nothing currently on the market that will allow you to eat gluten safely once you have celiac, so that is going to be part of your story long term, that you will be gluten free. But I've been gluten-free for 7.5 years, and I can tell you it gets a lot easier with time. Okay, so we took a deep dive today talking about some of the most common GI diagnoses out there and explaining some of the symptoms, the conventional testing and treatment, and I made some recommendations as far as things you can discuss with your doctor about alternative testing or treatment ideas. Stay tuned for our upcoming video where I'll be discussing more about eating for your microbiome and how food can be your friend or foe depending on what kind of food it is. So stay tuned for that. Again, as always, if this video was helpful, if it was valuable to you, please consider liking and subscribing to support me and to stay tuned so you can be connected with new information as it releases every Friday. Have a wonderful day, and I'll see you next time.